the federal government and governmental agencies and other places mandating that. So I do think that will spurn quite a bit of vaccine uptake. I'm also hopeful for those that were worried or hesitant that the review process was shortchanged or too short or too quick, that this will also increase their enthusiasm and remove their hesitancy for getting vaccinated. So I remain very hopeful. The proof is in the pudding, and we'll see what the numbers pan out in the next couple weeks. The next one, do you feel like herd immunity is still a viable option given how many have not been vaccinated? Again, I think based on my answer to the first question, I do think a lot of people are going to be forced to get vaccinated to maintain employment or school status. Herd immunity becomes more difficult as the transmissibility of the virus goes up. So Delta has certainly thrown us a curve, and it does appear that we're going to have to get our herd immunity up even higher than what we had expected in the spring. So we really need to get probably in the high 80s, low 90s of immunity, not necessarily vaccination, but overall immunity to get below a point where the virus can't easily spread within a community. Next question, has the hospital seen an increase in testing? And do we currently offer COVID testing and any plans to go back to drive-through? We do still offer COVID testing in a variety of different areas. Those areas are always listed on our internet site. They do change a little bit from week to week based on demand, but we do have a downtown site and a site in North Charleston that are open at least 6 days a week. We have seen an increase in testing from July to August by about threefold. We're running about 1,000 tests a day now, and that's definitely up from about 200 to 300 back in July. So the short answer is yes. It's not exactly drive-through like it was in the West Ashley Medical Pavilion. Most of them are more walk-up, but weather dependent. We do also offer some drive-through capabilities, especially for small children in our North Charleston area. Next question is, MUSC seen an increase in vaccines in the last month? And we have not only the FDA approval, but also the third dose booster shots for immunosuppressed. We did see quite a bit of additional uptake in vaccines in that patient population when we released that additional scope. Next question, what are the numbers for vaccine in July compared to August? And what is the hospital doing to encourage vaccination? So as I mentioned, we have seen a bump in vaccines per day. We were probably averaging as low as like 100 vaccines a day there for like June and July, and that's gone up to 300-400 a day. So again, about a threefold increase. Still not to the degree that we'd like to see. We'd love to have much larger volumes of vaccinations, and we have the capacity to do it, not only in manpower, but in vaccine supply. So we would definitely love to see higher numbers. As far as what we're doing to encourage vaccine, a lot of our work happens directly with our patients that, we try to encourage individual patients that we believe would, benefit from vaccine or that have had some hesitancy. We try to have one-on-one conversations. All of our primary care doctors and our hospital-based practitioners are all talking to all of our patients constantly about vaccination. In addition, as you know, we tirelessly create and disseminate public service announcements. We make individual talks. I know Dr. Mack, for example, has literally been all over the state talking about the benefits of vaccination, other public health, public health things that we can do to reduce the risk of COVID. So hopefully that answered the question. As far as our team members, as you know, we did mandate vaccination quite a while ago. We were definitely the first in the state, one of the first in the nation. And for the most part, I think it went relatively well. We do have some team members that have declined vaccination for legitimate, medical and religious reasons. But our vaccination rate amongst our team members is extremely high, in the high 80s. Next question. Can you provide us with the number of people with COVID, including the number in the ICU and the number on ventilators? Yes, if you'll give me 1 second, I can pull that up. As you know, that changes literally every minute. We do pull a report twice a day, so I'll give you our most recent numbers from this morning. And this is for all 3 divisions. So this includes Charleston, Lancaster, and Florence. But right now we have 129 in the hospital. 83% are unvaccinated. In the ICU, we have a total of 36 across the system. Only 1 of those is vaccinated, and 22 that are ventilated across the system. And I will have to get you that vaccination number. I don't see it offhand, but I'll get that for you in the chat. The other question that comes up is pregnancy. We do worry about our pregnant women that get COVID. We currently have 3 pregnant women in the hospital, all of which are unvaccinated. Next question, latest release from MUSC on COVID hospitalizations shows 81% are unvaccinated. Yes, that number does vary day to day, but it tends to be in the 80s. That's a big difference from the 97, 98 we were once seeing. What's the reason behind this? Is this a fluke or indication of something else at play? You know, it is a good question. I have seen some of the national statistics on the percent of hospitalizations and what percent are vaccinated or unvaccinated. I do have pretty high confidence in our numbers because we do look at those numbers on a one-to-one basis. So we're not using demographic data from large databases. We're using our own medical record. So there is a little bit of a discrepancy, but you know, whether the number is 85 or 97, honestly, I mean, I think we can all say with a straight face that, you know, what we are seeing right now is a disease of unvaccinated. We do have single digit patients that have been vaccinated that do end up in the hospital. Most of those are high risk patients. But again, you know, we can tease apart the numbers, but the vast majority of patients in the hospital, on vents, and in the ICU have not been vaccinated. Are there any plans to reopen the COVID unit? We did reopen the COVID unit this week in the adult main hospital in Charleston. So yes, that is reopened. We know most hospitals at this point in the state, aside from MUSC, have canceled their elective surgeries. Do you have any plans to do the same? We do not have any plans to cancel elective surgeries. I think what we learned from the spring is that deferring regular patient care is at the detriment to our community. And so we are going to try everything we know how to do to take care of patients, including preventive care and elective surgeries as best we can and as safely as we can. I do think MUSC is at a tremendous advantage of doing that because of our care team member vaccine mandate. So I think we are capable of safely delivering care in the COVID era, regardless of peaks and troughs. Next question, we know, MUSC Health Kershaw has put a policy in place that allows very few patients to have visitors. What came to that decision, and does any other hospital have plans? We now have a uniform visitation policy across all MUSC Health sites. It allows 2 people. I'm oversimplifying a little bit. There are some caveats for COVID patients, for example, but for the most part, it does allow 2 visitors at the bedside at any one time. So we are consistent across the health system, including Kershaw. We're hearing more and more stories of pregnant women getting COVID. Is it safe for pregnant women to get the vaccine? It is safe for pregnant women to get the vaccine. I think the preponderance of evidence does show that the risk of COVID significantly, substantially outweighs the risk of the vaccine in pregnant women. And we do strongly urge all pregnant women to get vaccinated as soon as possible. And with that, let me let Dr. Mack take a stab at some of the pediatric questions. Thank you so much.
Thanks, Danielle. So the first question was, why are COVID hospitalizations among children increasing? As Dr. Schur discussed, Delta is obviously significantly more contagious, and we have not achieved herd immunity. And I think it's important to know that actually in this state, less than 20% of 12 to 17-year-olds are fully vaccinated. The good news is, and I always like to remind myself and other people of this, is that this is within our control. We can change the trajectory of this pandemic, and it's the same behaviors that we've been talking about, right, for 18 months, and that'll get us where we need to be. So hand hygiene, masking, vaccination, testing, quarantining appropriately. In terms of kids in particular, masking and vaccination are incredibly important pieces of this puzzle. As you know, vaccination right now outside of a trial is not an option for kids less than 12. And the good news is that kids greater, or people 12 years old and greater, are eligible with very few exceptions for vaccination. And we are wholeheartedly recommending vaccination of children 12 and up. And hopeful for the possibility of vaccinating younger children, hopefully by the end of 2021. MUSC is participating in Moderna's Kid Cove trial, which is looking at the safety and efficacy of vaccination in children less than 12 years of age, which is going well. But outside of a trial, off-label use of vaccination in children less than 12 is not recommended right now. So the next question, can you talk about the study you contributed to about the risk of neurologic symptoms in children with COVID-19? What do parents need to be most concerned about? So yes, we participated in a study published in JAMA Neurology earlier this year involving almost 1,700 children in 61 centers across the country, including the MUSC, and found that 22% of children and adolescents hospitalized with COVID and MSC developed neurologic symptoms such as altered consciousness, seizures, difficulty walking or crawling. And fortunately, most of these symptoms were temporary, but for some, they were more serious and occasionally fatal. So again, I think just a reminder to us that children are affected and that we need to do all in our power to protect our most vulnerable, especially the ones that are younger than vaccination age, but all of them. The next question, could you provide us with the number of children with COVID who are hospitalized at MUSC, including the number in the ICU and the number on ventilators? So like Danielle said, the number is rapidly evolving, but as of this morning, we had 12 children hospitalized here with COVID this morning, 4 of those in the ICU, 1 of those on the ventilator. However, I know of 2 on the ventilator that are on the way. So that would make for 3 today. This has been a very different wave for children, and more children have been sicker this go round, and this is a national trend for sure. Next question. It seems that we're seeing more children hospitalized now for COVID at MUSC than ever before. Is that accurate, or is that just how it appears? Do we have a numbers comparison? So thanks to Montez, I did a little quick math this morning. And so for the purposes of this discussion, I'm talking about children birth to 21. And so total, we've had 180 children hospitalized with acute COVID, which has been evenly split between 2020 and 2021. However, 20% of our 2021 numbers have been in August, and we're not done with August. So if that gives you an indication of how quickly we've seen the rise over the last month or so, and note that every child that has been hospitalized due to COVID or MSC has been unvaccinated. Every child that we have seen has been unvaccinated, whether that was because they were ineligible because they were less than 12 years of age, or whether that was by choice. And I would just note also that half of our hospitalized pediatric patients with COVID have been eligible for vaccination. We have had about 30 MSC patients. In 2020, I think it was fair to say that MSC was generally more severe than COVID, but Delta, as Dr. Scher mentioned, has been a different ballgame, and acute COVID can be quite severe in children as well, and we certainly are seeing that. With no universal mask mandate in place and schools resuming in person without masks, are we worried that this winter would result in a twindemic, i.e. flu and COVID-19? So as you know, the CDC, DHEC, and AAP recommend masking universally in kids greater than 2 in the school setting. And as things have opened up and masking became less commonplace, I would say around the springtime, we have definitely seen a surge of other viruses other than COVID this year that we typically would see classically in the wintertime in children's hospitals around the world. So we're currently seeing our usual injuries and illnesses related to viruses that we would normally see in the winter, such as RSV or respiratory syncytial virus, rhinovirus, adenovirus, parainfluenza, and then of course, COVID and MSC. And we don't know how this obviously will trend, but I would say that it's incredibly important for kids to be caught up with their childhood immunization schedule, get their COVID vaccines for those that are 12 and up, and their flu vaccines for everyone 6 months and up. And then the final question was, what about Miss C, what are we seeing? What should parents be on the lookout for? So we, as I mentioned, have typically, or in the last month, we've seen a large number of acute COVID pediatric patients. And typically the Miss C wave follows the acute COVID surge by about 4 to 6 weeks. So we are bracing for what we likely will see with Delta. We don't know what that will look like, if it will be more severe or different in terms of the Miss C that follows. And that's multisystem inflammatory syndrome in children. And the CDC definition has not changed. So you have to be less than 21. And there is obviously a Miss A equivalent for the adult world. So it's divided by age, and then have fever, laboratory evidence of inflammation, and then be sick enough to require hospitalization and have at least 2 or more organ systems involved. And then sort of the thing that kind of is the clincher to make it Miss C is that there has to be some evidence of COVID exposure or infection. And I think at this point, I know we said this a year ago as well, but we can all consider ourselves all exposed pretty much. But we are bracing for that. And as I said, we've taken care of about 30 since the beginning of the pandemic. So I will pause there and open it up for questions, I guess.
Thank you both so much. If anybody has any questions they want to put in the chat or talk to the doctors, please let us know. I do have a follow-up real quick for you, Dr. Mack. How long do you think it will take for children under 12 to be able to get the vaccine shot? You talked about how 100% of our children patients were unvaccinated.
Yes, good question. There was some murmurings from the CDC yesterday that it would probably be late 2021. I know pediatricians had been hopeful that it may be closer to the fall or even closer to the start of school, but I think at this point we're sort of thinking it may drop to the 6 to 11 year age group potentially before the end of 2021.
Question for Dr. Schur. When looking at the trends for this winter, do we believe that COVID will still be an issue, or will the trend of the Delta variant will have gone down after its typical 8 to 12 week reign?
So the Delta variant will probably, the peak of the Delta variant will probably run its course relatively quickly. There's pretty good evidence from other countries and cities that have endured the Delta variant sooner than we have, that do indicate that the Delta variant, because it's so contagious that it, I don't know how else to say it, kind of rips through our community very quickly, and it peaks quickly and then it'll trough relatively quickly. So I do think that 8 to 12 week reign is probably about right, at least based on what our epidemiologists are predicting. So that is a piece of good news. What we don't know is what, how low is the trough? So when we get back to, what the baseline amount of COVID circulating in the community, how low is that? Again, based on the number of unvaccinated and the contagiousness of Delta, it may not get as low as it was before Delta. So that's one of the unknowns. And then the other, total wild card that we all already know to be true is that COVID continues to mutate and will, continue to march down the Greek alphabet with additional variants, the contagiousness and death rate of which is completely unknown at this point. So again, I think that the key to getting through a pandemic is immunity. And there's 2 ways to get immune. You can either get COVID and take your chances and see how you do and maybe end up in the ICU or not, or you can get a vaccine and get immunity. Not that vaccines are perfect. I don't mean to imply that. There are breakthrough COVID infections. We've seen them here, but most of them are pretty mild. And again, the differential between how people do with COVID vaccinated and how people do with COVID unvaccinated it's a stark reality that most people that end up in the company of hospitals are unvaccinated. So sorry, that was a little bit of a long answer, but I guess in summary, I would say we are hopeful that it's going to peak quickly and trough quickly. That is no question. That's our hope, and what our epidemiologists are telling us will probably happen, but we don't know how low it's going to get, and we don't know what the next variant will bring.
sticking with similar to that, can we talk about the vaccine booster shot and maybe who
Sure.
will need to get one and maybe the process of how it is in FDA approval right now?
Yeah, you bet. So the third dose boosters are currently approved for patients who are immunocompromised. So either immunocompromised from a disease process or from a medication. The full list of inclusion criteria are on our website, including, a question that says, am I eligible? And patients can get a vaccine at any vaccine site, just like they did in the past. We do anticipate the third dose booster indications will expand relatively soon. Our intel from the federal government is somewhere around mid-September. They're going to expand that indication to healthcare workers, elderly, and nursing home residents. So we do expect to hear more in the next couple of weeks, but we do anticipate those expanded indications for third dosing sometime in mid-September.
Do we have any other questions from reporters that want to put in chat or open in the discussion that you want to have unmuted? Please be our guest.
Hey, this is Lauren. Can y'all hear me by chance?
Yes.
Hey, I know that when y'all were announced you were mandating vaccines for employees, there were several hundred who had applied for a medical exemption based on the fact that they had a previous infection and developed antibodies. It seems like there have been some officials who've come out and said that that's not enough, and was wondering if y'all's policy on that had changed. Roper told me yesterday they hadn't decided what they were going to do on that.
Yeah, it's a great question. We have not changed our policy as of now. We're trying to follow the literature very closely and figure out if those that have documented COVID immunity, if and when they are going to be required to get a vaccine. And I think the jury's still out on that. So right now our policy hasn't changed.
Thanks.
Yeah.
Anyone else? All right. Thank you, Dr. Schur and Dr. Mack, for your time. We look forward to this, and thank you everyone for joining us. I know so many of you want to do individual stories and individual interviews, but we truly do appreciate you doing it as a group and helping save some of our doctors' time as we work through this pandemic. Thank you all for joining us, and you all have a good day.
Thank you so much. Have a good one.
Thank you, guys. Good to see you, Daniel. Thanks, Montez.
Record.